Hey, it's Dr. Deb Matthew here, president of the North Carolina Integrative Medical Society, and I am super excited today that I am talking with Dr. Anna Cabeca. She is a gynecologist. She now practices integrative medicine. She is the best-selling author of The Hormone Fix, which has been a USA Today bestseller, but it has also been a #1 Amazon bestseller for the last 14 months, which is really incredible. Her
In
next
menopause.
In menopause. Yeah, her next book is Keto Green 16. It is coming out May the 5th, Cinco de Mayo. So be on the lookout for that. And she is going to be joining us in July this summer in Asheville at the Southeast Regional Integrative Medicine Conference. And we are so excited to have her. She is going to be sharing tips on hot topics in women's sexual health. So Dr. Cabeca, it's so great to talk to you today.
It is great to be here with you, Dr. Matthew. Thanks for having me.
Can you tell us just a little bit about your journey to end up practicing medicine the way that you do?
Wow, it's really part of my personal journey. I was diagnosed with early menopause at age 39, and infertility. I was told I would never be able to have another child, and that took me literally on a journey around the world, looking for answers, and just I needed to keep the earth moving under my feet. But I always say, I went around the world to figure out that everywhere you go, there you are, right? Everywhere you go, there you are. And as a result of my journey and what I learned in the natural regimen, because my doctor's bag was empty, right? My Emory University doctor's bag was empty. And I reversed my early menopause, became pregnant, had a baby at 41. And so she's now soon to be 12 and I'm 53. So hormones, I always say it takes more than hormones to fix our hormones. And that's what I write about in The Hormone Fix, and just created these natural options for women and the men who love them.
That's awesome. One of the quotes that I have heard you say that I love is menopause is mandatory, but suffering is optional, which I
Yeah.
think is great because so many women don't really understand what's going wrong and they don't really know that there are solutions. And so they just suffer.
Right. And then they're afraid, okay, the estrogen is that safe? Is that not safe? I'm so symptomatic, but I don't want to be put on antidepressants or sedated or given something that could potentially cause cancer. So there's a lot of confusing and misunderstanding. So women power through, struggle, suffer, and relationships struggle as a result of it, right? Our intimacy and our connection struggles as a result of it. And that's something I really want to, certainly will clarify in my talk, Hot Topics and Women's Sexual Health, how there are many factors and what we can do about it as providers and physicians to really help women gain this um, their own power back over their body, and certainly through this transitional time period.
I read a study recently that did a survey and they came up with a statistic that said that 85% of women over 40 have sexual dysfunction issues of some kind or another. So this is something that is not rare. It's not unusual. It's really actually the norm. And medical doctors really don't have anything to help. I mean, we got the little blue pill for men, but we really don't have much in traditional medical circles to help women with these kind of problems. But do you have some good tips that you're going to share with us about what we can do?
Absolutely. And practical solutions, because it can just make a big difference. I'll give you the example. I have a client who was 62 and she came to my office and she said, Dr. Cabeca, my husband got the little blue pill. And every time we try to have sex, it is excruciating pain. And I did an exam, and certainly there was vaginal dryness and vaginal atrophy. Estrogen wasn't touching that. And there was also suture from a prior anterior repair procedure that had eroded through. And I will teach during the Hot Topics and Women's Sexual Health class what I did to prep that person for surgery, which worked so well that she didn't actually need surgery. So, and really re-epithelialize the vaginal mucosa. And again, she restored her libido and actually met me at the Brunswick Airport near where I live. One time she was there traveling with her husband. She brings her husband to me and she's like, "Oh my gosh, Dr. Cabeca, you gave me the best orgasm in my life." Yeah. So just being able to claim that intimacy and connection and be comfortable in your body. If we have pain every time we do something, we're not going to want to do it.
And this really affects marriages. And when women don't feel good, it doesn't just affect us, it affects our families, our children, our relationships, our careers. And for sexual health, it really isn't just, it is important. It's important for marriages. It's important for intimacy. It really is an important thing. And it's not something that we should feel uncomfortable talking about or that we should brush off. We really do need to take this seriously.
Right. And as physicians, we have to talk, we have to address these issues. We have to address intimacy, vaginal and vulvar health with our patients, because women will suffer, or send them to someone who will. And that's something I am just a huge advocate for, because I talk about it, blog about it, video about it, but vaginal and vulvar health is crucially important for the rest of our life, because those of us struggling with incontinence continue to suffer, right? What's next in line for them? Anticholinergics, which increase our risk of Alzheimer's. What's
Depends.
surgical procedure? Exactly.
Yeah.
All these incontinence pads that we can blissfully get, but the number one reason we end up in a nursing home is because of incontinence.
That's right.
It's the straw that breaks our backs.
And the truth is that there are a lot of things that we can do non-surgically that make a humongous difference for women, that we just need to let women know, because they don't know. All they know is the incontinence pads, or they see their gynecologist, and surgery is often, or the medications, like you said, is the choices that they have.
Yep, so true.
Well, I'm so excited that you're going to be with us. I know that there are going to be lots of people who really want to hear what you have to say, both for ourselves in the audience and also for what we can do for our patients and clients. So we really look forward to learning more about you. Is there a place that people can go if they want to learn more about you and more about what you have to say, even before they come to the conference? Do you have a website or somewhere they can go to find out more?
Yes, absolutely. DrAnna.com. So like Dranna, DRANNA.com. And definitely get my book, The Hormone Fix. It's out and available now. And it is something that like physicians just have loved reading it and recommending to their patients.
Yeah. And I have read it, and I have to say, I do agree that it's a great book. So thank you so much.
You.
Take care.